What is social care? With motor neurone disease, MND, or Kennedy's disease, there may come a time when you need support known as social care. This supports your well-being, but with help for daily living rather than healthcare. The aim is to help you prolong independence and maintain dignity. Social care can be provided at home or in residential care. It involves professional help to support your everyday routines, activities, and personal care. You may be able to get help with assistive equipment to make tasks easier. Information about care services may be included, or information to help you find out more about benefit claims and financial support. To see if you qualify for social care, your needs are assessed by Adult Social Care Services. If you do qualify, a care and support plan will be agreed with you and a copy provided. If you don't yet qualify, you can still receive information or be referred for specialist assessment, such as occupational therapy. This can all take time to arrange and complete, so it's useful to think about assessment as soon as you can. Anyone supporting you on a regular basis also has the right to a carer's assessment, even if you decide not to have your own needs assessed. You or your carer may be referred by a relevant professional to have your social care needs assessed. If not, ask for an assessment to be arranged. If you need help with this, someone can make contact on your behalf. In England and Wales, contact your local authority. Search for Find Local Council at www.gov.uk. In Northern Ireland, contact your local health and social care trust. Search for Health and Social Care Trusts at www.nidirect.gov.uk. If your needs are urgent, mention this when arranging your assessment. This may help speed up the process. You have a legal right to this assessment and information about social care, no matter what your personal or financial circumstances might be. And you can ask for your assessment to be carried out in the language of your choice. If you meet the criteria to qualify for support, you have the right to receive agreed support services, a review of your support if your needs change, and to appeal or challenge any decision you feel is wrong. Your assessment looks at whether you need help to manage your eating and drinking needs, personal hygiene, toilet needs and clothing, home environment and safe use of your home, family and personal relationships, access to and taking part in work, training, education or volunteering, use of necessary community facilities, local services, public transport and recreation, or caring responsibilities you may have for a child. Give lots of detail to get the level of support you really need. For example, if you explain that, I find it difficult to get dressed, they may not fully understand. But if you tell them, I cannot do up buttons or zips anymore, even with assistance, it can take over an hour to get dressed and I find it very tiring, then they can plan appropriate support. If you would like support during your assessment, you can have a partner, carer, relative, friend, or professional advocate with you. Keeping a diary of activities before your assessment can help. Include how long tasks take and if problems are increasing. It may help to ask those close to you if they have noticed anything you should include in your assessment. Your care and support plan may be different to someone else's, as your circumstances may be different too. You may need to pay towards any agreed support services. In England or Wales, you will be financially assessed by your local authority to see how much they will fund and how much you need to pay. This is known as means testing. In Northern Ireland, most social care is free, but you may be financially assessed in some circumstances. For example, in Northern Ireland, means testing applies for services such as Meals on Wheels, home help, or if you accept a place in a nursing care home. Financial assessment looks at your income and savings. If you have a partner, your share of joint savings will be included, but not their own income or savings. If you own the property you live in, it will not be taken into account when receiving care at home. However, your property may be taken into account if you move into a care home, unless someone else still has the right to live there. During your financial assessment, explain anything you spend that's related to disability, as this may help you get appropriate funding. For example, specialist food, clothing, equipment maintenance, or travel. If you think your income may be over the threshold for funding, don't let this put you off getting assessed. You can still get guidance and help to organise support. If you want adult social care services to organise the support services in your plan, let them know at your assessment. Or you can receive money to pay for your support yourself, known as direct payments. These payments give you more control over how your needs are met and which services you use, but you will need to keep accounts. If you think you will need extra help to manage your direct payment, ask at your assessment, as there may be differences in the way support is offered across Wales, England, and Northern Ireland. Direct payments can help you employ your own personal assistant or regular care workers at times of day when you most need help. If you employ anyone directly, you take on the role and responsibilities of an employer, unless you use a care agency who act as an employer on your behalf. Ask for guidance at your assessment. For more details about assessment, support, direct payments, and how to challenge decisions, see our information sheet. 10B. What is social care? Find this in Information Sheets at www.mndassociation.org/care-info. Our MND Association support also includes a benefits advice service to help you identify and claim benefits you may be entitled to receive. Find out more at www.mndassociation.org/benefits advice. For further support, contact MND Connect on 0808 802 6262 or email mndconnect@mndassociation.org. Our helpline is free to landline and mobile phones in the UK.